What is the irritable bowel syndrome? We all have our own definitions, but these are some of the facts. It's a medically unexplained illness affecting the bowels. The symptoms include bowel disturbance and abdominal discomfort and many other symptoms, often in different parts of the body. Fatigue is very common. Muscle pains are very common. The irritable bladder is very common. A backache is very common. Is it a malaise of the individual? Yes, it is. It's a very individual illness. If you get a lot of people with IBS in the same room, they all say, well, you've got IBS, but your symptoms are very different to mine. You've got diarrhea, I've got constipation, you've got backache. In other words, it's very much an individual illness with individual contexts and association. A number of foods that we know that can be associated with IBS. Fat, often forgotten these days. Fat, I think, is a really important one. It stimulates a gastrocolonic reflex. It can cause colonic spasms and irritability. A fatty meal is not good for people with irritable bowel. Fibre, particularly insoluble fibre, not good news. Wheat. Some people with IBS are sensitive to wheat. They may not have celiac disease, but there is a growing experience-based rather than evidence-based of gluten sensitivity. FODMAPs, we all know about fermentable sugars, at least the dietitians in the room know about fermentable sugars and in fruits and vegetables, and know how these may be implicated in IBS associated with bloating. Hot spices, coffee, but also mood, emotion, changes in life, stress, the memory of what may have happened, the meaning of what may have happened, or foods. All of these things can affect the sensitive bowel. And a number of things can make the bowel sensitive. A previous infection can, and also stress, of course, can make the bowel more sensitive. This is some research we did some years ago where we took people with who got irritable bowel syndrome for the first time after an attack of gastroenteritis. It was a prospective study of 104 subjects, and we saw them when they came into hospital with gastroenteritis. And we were interested in what predicted persistence of those symptoms, because the gastroenteritis, by and large, it goes away very quickly. It doesn't last. But in some patients, it persists and it goes on. So we found that 22 of the 104 subjects, the symptoms persisted for 6 months. And we went back to our original questionnaires that we took when they first came into hospital, and we found that anxiety, neuroticism, life events, something going on at the time, predicted the persistence. A lot of people as they get older have weight and diet problems. Everything, if only they could actually lose weight, they would feel so much better. Oh, there's this patient here. It's the lack of sleep that makes it so much worse. And IBS in old age. What's going on in old age? It's this patient here. Since I lost her, I rarely get the feeling I want to go. So loneliness is an issue, illness, despair, and not able to look after yourself terribly well, an inadequate diet. Things that we are placing a lot of emphasis on in the network at the moment. We want to create a comprehensive self-care plan that allows people to have some resource to look after themselves. But if they have that resource, what we want, they still need contact with people. At the moment, the GP is really too busy, I think, to look after people with IBS. What we need to do is to recruit people like yourselves who are healthcare professionals who you may have more time to understand and listen and help people with irritable bowel syndrome.